film presentation explains the Hospital Incident Command System. It is an introduction to disaster response for hospital staff, providing a framework and management tools to continue patient care under any circumstance. Disasters.
214 heavy emergency vehicles are responding.
Air crashes.
Then an emergency reported in the stadium.
Explosions. Fire. Earthquakes. Floods. Disease. Terrorist attacks. They all have one thing in common. Hospitals are one of the first places victims turn to for help. The extra demand required to help disaster victims can be overwhelming if the medical staff is not prepared. Responding quickly to a disaster situation so that all patient care can continue uninterrupted when a surge of new patients arrives is a challenge that can and must be met.
Actually, what we're doing is categorizing our patients as far as where they're going to go.
Hospitals are now using a standardized process for emergencies. It is called the Hospital Incident Command System, or HICS.
The Hospital Incident Command System provides a flexible reporting structure. It defines roles and responsibility, sets up communication flow and documentation.
We're relatively well organized, and we're surfacing some opportunities where there's some questions that we need to clarify.
It is designed to use common terminology and organizational structure that can be used for all hospitals to integrate with public safety responders. One important advantage of HICS is that most outside agencies use a similar incident management system.
On three. 1, 2, 3.
In the chaos of a terrorist attack or natural calamity, shared incident command models greatly improve communication.
L2, we have a subject down wearing scrubs with a gun by his right side.
The objective is to provide the hospital operations section with strategic direction and support by focusing additional resources, such as staff and equipment, on where it is needed most.
I was checking on the power loss at CT number 2.
The Hospital Incident Command System is composed of two essential groups, the command staff and the general staff.
The command staff consists of the incident commander, public information officer, liaison officer, safety officer, and medical technical specialist.
The incident commander is in charge of the entire operation and will determine which parts of the plan will be activated.
The public information officer, or PIO, will provide important information updates to external media, staff, and patients.
Staff that we will be providing additional updates within the next hour.
Received word that all patients that we are expecting have been transported and are at the hospital.
The liaison officer acts as a conduit between the hospital and outside agencies, such as public health, other hospitals, law enforcement, fire, and EMS.
We start to get her packaged up, get her on oxygen.
The safety officer is responsible for assuring safety of the hospital responders, visitors, and patients. The safety officer also monitors the response and anticipates any hazardous operations or conditions. The medical technical specialist assists the incident commander by providing event-specific advice and counsel. The role can be staffed by a physician if the incident is medical.
The general staff has 4 positions: operations, planning, logistics, and finance. They are called section chiefs.
We're waiting for the results of...
The operations section chief develops and implements strategy and tactics. He or she carries out the objectives established by the incident commander, including staging, medical care, infrastructure, security, hazardous materials, and business continuity. The planning section chief oversees all incident-related data gathering and analysis regarding incident operations and assigned resources. Planning is responsible for developing alternatives for tactical operations and prepares the incident action plan for each operational period.
There is water now delivered up in the ED area.
The logistics section chief obtains any necessary resource asked for by operations and planning, supervising damage reporting and control, sanitation, supply, transport, and nutrition. If more medical supplies are needed, The logistics section chief is in charge of getting them.
Also called our bank. We both entities bank with B of A to make sure there's no free.
Finance section chief monitors costs related to the incident, providing accounting, procurement, and analyses. Each role can be activated or deactivated throughout the response, depending on the need at that time. This flexibility allows HICS to be used efficiently in large and small-scale disasters, and by large or small hospital settings. Each team member is given a job action sheet that outlines their job description and responsibilities. All this is contained in an incident action plan, which formally documents objectives and incident strategies. Let's take a look at HICS in action and the various roles of the hospital incident management team. A mass casualty event has occurred, causing a surge of patients. A hospital-wide emergency is declared, and the command center is activated. The incident commander asks for a medical technical specialist to advise on issues related to hospital operations during a surge of patients. Working through the hospital incident command system, the medical technical specialist will help maintain the routine flow of hospital patients and materials, responding to any disrupting issues.
Anything else?
The hospital incident management team gets a briefing from the incident commander. Then, job action sheets are reviewed, and the process of documenting all actions taken as part of the incident action plan begins. If needed, staffing assistance will be drawn from the labor pool.
At the labor pool, medical staff is assigned to specific casualty care areas for immediate, delayed, and walking wounded patients.
As the incident progresses, the command staff learns that there is an influx of children. The operations section chief wants a pediatric medical technical specialist to advise on casualty care for children because they have unique needs. During the mass casualty event, the operations section reports that multiple trauma patients need surgery. The medical care branch director in the operations section works to free up space in the ORs to allow room for incoming patients. As the influx of casualties continues, there becomes an immediate need to open hospital beds within a short time frame. The incident commander, in coordination with the medical technical specialist, orders that the rapid discharge plan be activated. Nursing supervisors and admissions usually will identify the number of beds that may open in the next 2 to 6 hours.
We want to activate a second 99. We have a second.
The charge nurse of each unit will relay this information to the hospital command center. The public information officer develops messages on the impact to the hospital. Before these messages are released, they will be reviewed and approved by the incident commander. The incident progresses. The medical technical specialist participates in briefings with the command staff and meets regularly with the planning section chief, updating the incident action plan. Hospitals cannot afford to be passive about disaster response and recovery plans. As we have experienced recently, terrorist attacks and disasters are part of our reality, and we have a unique opportunity to lead, providing the best medical care for patients and the community through the Hospital Incident Command System.